called Revolutionizing Healthcare Through Cannabis. And before I start, I just want to give you all the heads up to like and subscribe and share. Follow me on Instagram at Cannabis Nursing Solutions. So I'm going to go ahead and get started. And if you didn't see the last video, it was from the Cannabis Nurse Network Spring Symposium or Spring Fling, one of the two. But in that video, I let people know that I'm going to start repurposing my presentations for YouTube for free. A lot of the presentations that I've done have been paid for presentations, and I feel like you should have access to the things that I have to say, at least for free. So, therefore, it is going on YouTube. So, I hope that you all enjoy. If you do, let me know in the comments. So, I'm going to go ahead and get started. This is called Revolutionizing Healthcare Through Cannabis. So let's break it down. Healthcare. What does it mean? Healthcare is a system that comprises all organizations, institutions, and resources that produce actions whose primary purpose is to improve health. It refers to the institutions, people, and resources involved in delivering health care to individuals. So, in those two sentences alone, we're talking about hospitals, we're talking about rehabs, we're talking about nursing homes. We're talking about nurses, we're talking about doctors, CNAs, techs, whatever you want to call them, uh, therapists. We're talking about all the people who are involved in delivering the healthcare to individuals. And those people who are involved are usually in the role of promoting health enabling conditions in individuals and in the community. And they always have to evaluate and strive to improve the performance of the healthcare delivery model. And then we're talking about a revolution here. So, are we in the midst of a healthcare revolution? Let's define revolution. What is a revolution? A revolution is a turning point in history. It is when a significant change occurs, and it would not be the same today if that change did not occur. When I see that definition, it mostly appears to be coming from the historical context. So you don't necessarily know if you're in a revolution unless you're looking back at history. And basically, what you're doing is looking at the details of what was the significant changes and the turning points at a specific point in time and defining it as a revolution. So, are we in a revolution? Let's talk about it. So, again, we can't help but mention COVID-19 during this time period. We're in 2021, it's September, about a year and 9 months or so of pandemic, the pandemic experience. And it has largely led to a mass exit of healthcare providers. And that, in and of itself, has led to short staffing, whether it's through sickness, mental or physical health. So, if you're experiencing burnout, fatigue, overall anxiety, or the physical side of it is actually contracting COVID itself. And that's led to short staffing. And then general dissatisfaction. The reality is that a lot of healthcare providers are generally dissatisfied on a regular day. You add COVID to it, and they're uber dissatisfied because COVID didn't come with a set of instructions. So healthcare administrators were figuring all of this out on the fly. And because there's short staffing, that means there's higher patient ratios. And again, leading to further dissatisfaction, shorter staffing, and increased patient utilization and forced operational changes. So, because we're experiencing that short staff, those higher ratios, there are problems that quote unquote need fixing, and they want to create solutions. So I mentioned in a few other videos that Lean Six Sigma or performance improvement metrics or uh, ways to fix problems use a specific process, and the widgets are the patients. So ultimately, they are looking to fix the problems that lead to poor patient outcomes. And sometimes those solutions that they're trying to fix are very superficial. Then there's social unrest. We're going to define social unrest. It is a condition in which people can be easily aroused. The characteristics of social unrest include general impairment of collective life routines. People are hyper reactive. Restlessness becomes a shared experience, and it is not specific to specific grievances or activities. So when we talk about social unrest, it's a collective experience where people are responding to specific triggers. You know, we hear triggers are out here all the time, and it is a shared experience. And that's where we are right now. Ever since the murder of George Floyd, and a whole bunch of other social issues that have arrived over the past year and a half, specific to a hospital, people are dissatisfied due to lack of acknowledgement, inclusion in decision making, and just generally being disconnected from administrators or being disconnected from management or staff. And it's a huge issue because the social landscape is magnified in a hospital or in a healthcare setting because it is reflective of the issues that exist as a whole. And let's talk about our patients. They're also a part of our healthcare system. They're becoming more and more acknowledged in the care that we're offering them. They're allowed to participate in their own health treatment planning. And with technology making information accessible, they have the tools to participate in their own healthcare. They can do Wikipedia and all of that. Patients are choosing cannabis as their treatment modality to increase their quality of life. People are depressed. People are anxious. People are tired of being confined, wearing masks, being forced to take vaccines that they don't necessarily trust. They are tired. So, the one thing that they can rely on is cannabis. And if they can get clean, legal cannabis, that's what they're choosing. The statistics show that that's the choice that they are making. And they are relying less and less on healthcare because they don't trust the system. And we'll pause on that. Then there's healthcare providers. We're going to talk about nurses. I'm a nurse. We all know I'm a nurse. But they are the largest employed staff of any healthcare facility. Nurses are the most trusted profession, but they're generally unaware of the endocannabinoid system, which is unfortunate. It's the largest neuroreceptor system in the body. And in addition to that, we largely ignore a patient's consumption of cannabis. And that means to utilize appropriate interviewing techniques for the patient who consumes cannabis. Thus, a comprehensive assessment cannot be complete. Whether we think it's being complete or not, it's not. So, when we look back at this time, what will be identified as the catalyst for the healthcare revolution? I don't know. But patients are empowered to take control of their healthcare decisions. It is their right to choose cannabis as a treatment modality, and we are here to drive the revolution forward. So, with that, I'm going to leave you with this thought. Collective thought stimulates dissemination of ideas. If we all are understanding the same ideas, it is our responsibility to share it with the world. We cannot continue to ignore cannabis as medicine. We cannot continue to ignore the endocannabinoid system. We cannot continue to ignore the role of healthcare providers in sharing the information to the general public. And we have to fix the issues, the real ones, not the widgets. We need to fix the real issues in healthcare. So that's the end of my talk. Thank you for listening. Um, Please like, share, and subscribe. Again, follow me at Cannabis Nursing Solutions on Instagram. If you're interested in taking a training course and learning more about the endocannabinoid system, go ahead and email me at cannabisnursingsolutions@gmail.com, or you can go to my website, www.cannabisnursingsolutionsllc.com. Thank you so much for listening. If you have any questions, leave it in the comments. And I would love it if you could put a purple heart emoji in the comments to let me know that you got to the end. Thanks. Bye.